We're going to do a quick walkthrough of the bill with the research staff, and then we're going to go right to public testimony. We may do part of the walkthrough tomorrow with Ms. Clark-Best in certain sections. But if the researchers could just start off with 2, Randy, if you want to start off with 2, and then without coming back to the chair, if we could just walk through them, if you guys could just kind of follow along Sunday school style, that'd be great.
Sure. Mr. Chair and members, Article 2 is the healthcare article, and that begins on page 67 of the Delete Everything Amendment. Section 1 is from, it's a modified version of language in House File 3132. This would allow the Department of Public Safety to provide last 4 digits of Social Security numbers to DHS for purposes of recovery of Minnesota healthcare benefits. Section 2 is from House File 2725. This would require the DHS, when using unexpended balances in their technology accounts, to first obtain a review from the Legislative Advisory Commission. Section 3 is from House File 2919, dealing with telemedicine services. This adds community paramedics to the list of providers that can provide telemedicine services, and it provides an exemption from the limit on coverage of 3 telemedicine services per enrollee per week if the services are for the treatment of tuberculosis. Section 4 is from House File 1269, dealing with federally qualified health centers. The language on the page, bottom of page 72, would allow FQHCs to submit their claims directly to DHS for payment, and right now they submit them through the managed care plan. Section 5, also from House File 1269, it requires DHS to report on a process to allow FQHCs to obtain 340B drug discounts and to avoid duplicate discounts. Section 6, this is House File 2761. This is the language that requires DHS to reconcile Minnesota Care premiums. There was an amendment added that prohibits DHS from using agency staff or resources to offer a product similar to Minnesota Care, and there's some financial penalty language. Section 7 is from House File 3132. It directs DHS to contract with the vendor to implement the third-party liability recovery program. This is the modification of language that was in the actual bill. Section 8, this is House File 3198. This section requests the legislative auditor to study rate disparities or geographic rate disparities in the individual and small group markets.
All right, Mr. Chair and members, Article 3 is the chemical and mental health article. Section 1 is from House File 1331, and it specifies how data collected by a sheriff or corrections agency for individuals who may have a mental illness, it specifies how the data is treated. Sections 2 through 7 are from House File 3455, and this was one of the amendments that was recently added. Section 2 allows the Commissioner of Human Services to issue a temporary change of ownership license or provisional license in certain circumstances. Section 3 requires a license holder to notify the Commissioner of Human Services and obtain approval before making any changes that would alter the license information, and also lays out some requirements related to the notification. Section 4 lays out requirements for a license application after a change of ownership. Subdivision 1 specifies that a license is not transferable or assignable. Subdivision 2 requires the submission of a new license application when a change of ownership will occur and specifies what constitutes a change in ownership. Subdivision 3 lays out the requirements for when a change of ownership occurs. And subdivision 4 establishes a temporary change of ownership license for a new owner or operator while the commissioner evaluates the license application. Section 5 is also from House File 3455 as amended. It requires the commissioner to set aside a disqualification for an individual in the chemical dependency field who's a nonviolent controlled substance offender and who has successfully completed treatment and has abstained from controlled substances for at least a year. Section 6 relates to the set-aside in Section 5. Section 7 is also from House File 3455, and it specifies that the assessment of need process that is currently in Minnesota rules does not apply to programs, substance use disorder programs licensed under Chapter 245G. But it does allow the commissioner to deny a license if the services in the local area are sufficient to meet local need, and new services would be detrimental to those in the area. Section 8 is new language that removes language governing the transfer of funds from the Chemical Dependency Fund for specific administrative purposes. Section 9 is also from House File 3455 as amended. It removes a provision requiring prior approval from the commissioner for chemical dependency services, but again allows the commissioner to deny a license under certain circumstances. Section 10 is from House File 3455 as amended, and the original language was from House File 4307. It updates terminology related to the post-arrest community-based service coordination for individuals with mental illness or substance use disorder, and adds language including Indian Health Service facilities, and adds two types of service providers who may provide this care coordination. Section 11 is from House File 1331. It allows a sheriff or local corrections staff to share certain mental health data and other private data on inmates, and to refer an offender to the local county social services agency to arrange for listed services. Sections 12, 13, and 14 are all from House File 3134, I believe the first engrossment. Sections 12 and 13 modify the effective date for the provisions governing state-only MA funding payments for mental health services provided in children's residential facilities. And it extends the effective date for 2 months. And Section 14 extends the deadline for the Children's Mental Health Report until January 15th, 2019.
Article 4 is the opioids and prescription drug article. Section 1 is from House File 3024. This is dealing with prohibiting pharmacy gag clauses. So it provides that a contract cannot prohibit a pharmacist from informing a patient when the amount the patient is required to pay would be greater than the out-of-pocket costs. Section 2 is from House File 2987. This sets up the prescription drug repository program to provide donated drugs and related medical supplies. And that goes all the way to page 98. Then Section 3, this is House File 3024. This was language, I guess, amended on in modified form from House File 3012. And this basically would prohibit a health plan company or PBM from requiring an individual to make a payment in an amount greater than the allowable cost. And the allowable cost is defined as either the co-payment amount or the out-of-pocket amount that would be paid if a health plan benefit was not used. Section 4 deals with limitations on the dispensing of prescription drugs. This provides that there is a 30-day limit to fill a prescription or to refill a prescription. Section 5 is from House File 3062. This directs DHS to establish a program to award grants to secondary school students and undergraduates to conduct opiate awareness and opiate abuse prevention activities. This language is modified from the bill that was heard in committee. The bill in committee was sort of contingent upon obtaining federal grant funding, and this delete all amendment provides funding for the program itself. Section 6 is from House File 3535. This directs the Commissioner of Health to provide grants to ambulance services to fund community paramedic teams to reduce opioid overdoses. And Section 7 is a repealer from the Drug Repository Bill, House File 2987. It repeals an existing cancer repository.
Mr. Chair and members, Article 5 is the Community Supports and Continuing Care article. Section 1 is from House File 3193 that creates a transition period when transitioning from day training and habilitation services to the new employment services under the disability waiver rate system. Section 2 is from House File 3139. This creates MA rates for the prescribed pediatric extended care centers. Section 3 is from House File 3251. This just changes terminology for the Home and Community-Based Services Innovation Pool. Sections 4 through 13 are all from House File 3191, which is the big disability waiver rate system bill that does several things. It creates a new competitive workforce factor. It removes the regional variance factor. It provides for some more robust reporting requirements. And it also changes the timing of the inflationary adjustments. If you're following along in the bill language, you can skip to page 125. Section 14 is from House File 4030, and that provides for a rate increase for a specific ICFDD facility. Section 15 is from House File 490. That provides for a nursing facility rate adjustment for a facility in Moorhead. Section 16 is from House File 3191, the DWRS bill, and this just removes some language related to some of the DWRS rate stuff. Section 17 is from House File 4206. That's the electronic visit verification bill. Modifies the electronic visit verification. Section 18 is new language. This is part of the DWRS package. It creates competitive workforce sustainability grants. Section 19 is from House File 3139. This is related to the prescribed pediatric extended care, and it just directs the commissioner to submit to the Federal Centers for Medicare and Medicaid Services any MA state plan amendments that are necessary. Section 20 is from House File 3451. This is related to the brain injury and CADI waivers, and it is allowing for service capacity to be transferred from one facility to 3. Section 21 is new. This is also related to the disability waiver rate system package, and this is just a direction to the commissioner related to submitting federal approval and setting out priorities for how that submittal should work. Sections 22 and 23 are from House File 4206. That's the electronic visit verification bill.
Mr. Chair and members, moving on to Article 6 of the bill. This is protections for older adults and vulnerable adults. All the provisions in this article were taken from House File 3308, the first engrossment, with the amendment that was adopted in the Finance Committee, and House File 3857. Section 1 amends the Healthcare Bill of Rights to allow patients and residents to exercise any of the rights in the Healthcare Bill of Rights free from restraint or coercion. Section 2 adds language requiring nursing homes to submit correction orders. Section 3 amends the Home Care Bill of Rights to provide that a person receiving home care services has the right to recommend changes in the services free from restraint or coercion. Section 4 amends home care statutes to require the Commissioner of Health to survey a temporary licensee within 90 days after the Commissioner receives evidence that the licensee has begun providing home care services. Section 5 defines change in ownership survey for purposes of home care and requires these surveys to be conducted within 6 months after issuance of a new license due to a change in ownership. Section 6 establishes correction order requirements for home care providers. Section 7 amends the duties of the Director of the Office of Health Facility Complaints to specify that the Director has authority to issue correction orders and assess fines for all licensing violations or maltreatment determinations, including those identified as part of an appeal or review. Section 8 directs the Office of Health Facility Complaints to establish a safety and quality improvement technical panel. And Section 9 directs the establishment of a training and operations panel at the office. Section 10 establishes posting requirements for housing with service establishments regarding owners, managing agents, and persons authorized to accept service or process. Section 11 adds a cross-reference Section 12 establishes notice requirements as part of the Maltreatment of Vulnerable Adults Act to allow reporters to receive notice. Section 13 directs the Commissioners of Health and Human Services to develop written guidance materials for facilities and providers to help them with comply with reporting requirements. Section 14 modifies biennial reporting requirements to the legislature by the Commissioner of Health and Commissioner of Human Services related to maltreatment. Section 15 modifies retaliation language prohibiting retaliation against people who report maltreatment of a vulnerable adult. Section 16 requires the Safety and Quality Improvement Technical Panel to give a report and recommendations to the legislature on the listed information. Section 17 requires the Commissioner of Health to develop immediate penalties for serious violations of state law and submit those recommendations to the legislature. Section 18 establishes quarterly reporting requirements regarding the Office of Health Facility Complaints response to vulnerable adult maltreatment allegations. Section 19 establishes an assisted living and dementia care licensing working group. Section 20 establishes a dementia care certification working group. And Section 21 establishes an assisted living report card working group.
Mr. Chair and members, Article 7 is the Children and Families article. Sections 1 through 7 are all from House File 3778. It's the Child Care Assistance Bill that makes changes related to homeless families, transition year families. It modifies the frequency of the child care market rate survey, modifies the portability pool, and it modifies the maximum rates by setting them based off of the 2016 child care provider rate survey.
Section 8 of this section of this article removes the requirement for child care providers to physically post a correction order, and that's from House File 3015. Section 9 is from House File 4094, and it allows those who teach training courses, childcare training courses, to count the hours spent conducting the training towards their annual training requirements.
Mr. Chair, Section 10 is from House File 3627. This is related to the homeless youth report, and it just exempts the commissioner from preparing this report in 2019 and instead requires the commissioner to update the 2007 report on homeless youth.
Section 11 is from House File 3133 as amended. It establishes grants for stable housing and support services for vulnerable youth, and also allows for program variances for certain programs that would like to serve a wider range of ages. It also requires the Commissioner of Human Services to consult with providers serving homeless youth, sex-trafficked youth, or sexually exploited youth, and make recommendations to resolve some conflicting requirements and to foster best practices. Section 12, it relates to House File 2996. That's the Child Welfare Training Academy bill. This section allows or requires that funds withheld from counties that do not meet certain child protection performance outcome thresholds be transferred to be used to support the Child Welfare Training Academy. Section 13 is from House File 2996. It requires that the commissioner partner with the University of Minnesota's MinLinks statewide data project to conduct a study on outcomes in the child welfare system. Sections 14 and 15 are from House File 3406 and modify certain provisions related to child support.
Mr. Chair, Section 16 is from House File 3627, and this relates to the homeless youth report and just requires the Commissioner of Human Services to update the 2007 legislative report on runaway and homeless youth, and lays out some guidelines for how the commissioner should update that report and the information that should be included.
Section 17 is from House File 3246. It establishes a task force on childhood trauma-informed policy and practices. It lists who should be on the task force, how the task force will be staffed, the duties of the task force, and requires a report to the legislature and also specifies that the task force expires after the report is submitted. Section 18 is from House File 2996. It requires that the Commissioner of Human Services modify the Child Welfare Training System and rename it as the Child Welfare Training Academy, and sets out the requirements for this new training academy, including that it will have 5 regional hubs with training targeted to the needs of each region. Section 19 is also from House File 2996. It's requiring the Commissioner to conduct a child welfare caseload study. And Section 20 allows the Commissioner of Human Services to make rules necessary to establish the Child Welfare Training Academy.
Mr. Chair, Section 21 is a reviser's instruction that just instructs the revisor to update terminology related to the Supplemental Nutrition Assistance Program. And Section 22 is from House File 3778. That's the Child Care Assistance Bill, and it's a contingent effective date that makes the changes to the CCAP program contingent on receipt of federal funding, and then also lays out priorities for implementing the changes that are in sections 1 through 7.
Mr. Chair and members, Article 8 is health licensing boards. Sections 1 and 2 and various other sections in this article are from House File 3367, which adds advanced practice registered nurses to various statutes, giving them the authority to engage in specific actions or certify or provide certain information. So Section 1 adds APRNs to a section related to public data. Section 2 modifies the Healthcare Bill of Rights by adding APRNs to those persons who may document that an activity is medically inadvisable. Section 3 is from House File 3101, and this authorizes the Board of Examiners for nursing home administrators to issue a health services executive license. Section 4 is also from House File 3367, and it adds APRNs to those who must receive notice and work to comply with the Healthcare Directive Act. Section 5, which starts on page 176 and goes until page 193, establishes and enacts the Nurse Licensure Compact. And Article 1 of this section of the Nurse Licensure Compact defines certain terms. Article 2 outlines general provisions and jurisdiction related to the compact. Article 3 outlines the requirements for applications for licensure in a state that's a party to a contract, or to the compact. Article 4 relates to additional authorities invested in state licensing boards in a party state. Article 5 establishes the Coordinated Licensure Information System and outlines requirements for the exchange of information through that system. Article 6 establishes the Interstate Commission of Nurse Licensure Compact Administrators. Article 7 establishes the rulemaking powers of the Interstate Commission. Article 8 outlines the oversight, dispute resolution, and enforcement provisions related to the compact. Article 9 establishes the effective date, how to withdraw from the compact, and how to amend and how the compact can be amended. And Article 10 deals with provisions related to construction and severability related to the compact. Section 6, which is on page 194. Just bear with me one second. Is also from House File 3848, the Nurse Licensure Compact. And it clarifies the applicability of the compact to existing nurse licensure laws in Minnesota. Section 7, also it specifies a definition of head of the nurse licensing board and authorizes the Board of Nursing to recover costs of investigating allegations against multi-state licensees. Section 8 on page 195 is from House File 4193, and this relates to Board of Optometry fees. Section 9 is from House File 4192, and it relates to Board of Social Work fees. Section 10, Sections 10, 11, 12, and 13 are all from House File 3571, the first engrossment. So Section 10 allows a pharmacist to accept a prescription drug order when not present in a pharmacy in certain specific emergency circumstances. Section 11 relates to the processing of those prescriptions in emergency circumstances. And Sections 12 and 13 relate to pharmacy licensure requirements, and Section 12 specifies that licensing requirements do not apply to manufacturers, wholesale drug distributors, or logistics providers who distribute home dialysis supplies and devices if they meet certain requirements. Section 13 provides an exception to a prohibition on licensed wholesale drug distributors for those distributing home dialysis supplies. Section 14 on page 202 is from House File 3640, the first engrossment. And so sections 14 to 19 are all from this bill and relate to the Health-Related Licensing Board background check updates and changes to the background checks. And Section 18 relates to temporary license suspensions for health-related licensing boards. Skipping to Section 20, that is from House File 3023, the second engrossment. It requires continuing education credits on best practices in prescribing opioids and controlled substances, and it requires 2 credit hours within the current requirements for licensees with prescribing authority. Sections 21 to 27 are all from House File 3367, and they all add APRNs to various statutes. Section 28 is also from House File 3640, and it amends the chapter governing rehabilitation and employment of criminal offenders, and specifies that chapter does not apply to licensing or registration for the health licensing boards. Section 29 is from House File 3195, and it establishes the Council of Health Boards work group to study and make recommendations on increasing access to telehealth clinical experience. And Section 30 is a repealer, and it repeals a section related to planning for health board criminal background checks, which is addressed in House File 3640.
Mr. Chair and members, Article 9 is the miscellaneous article, and that article begins on page 217 of the amendment. Sections 1, 2, and 3 are from House File 3543. Section 1 changes MNsure's operations funding. It lowers the premium withhold percentage that MNsure is authorized to retain from 3.5% to 2%. And it also limits, it caps the total amount that MNsure can collect in a year at 25% of the MCHA member assessment from 2012. Section 2 provides that a health plan that meets the minimum requirements in state and federal law for certification as a qualified health plan can receive such certification, and provides that MNsure is not authorized to establish additional certification requirements. Section 3 prohibits the Commissioner of Human Services from bearing insurance risk or entering into an agreement to pay claims for health coverage for a state health care program that's available for purchase through the MNsure website as an alternative to purchasing an individual health plan. Section 4 is from House File 3056, and it authorizes licensed physical therapists to provide a medical statement that can be used to obtain a disability parking permit or disability plates. Section 5 is from House File 3172. It amends the predatory offender registration statute to require the predatory offender notice of status required in that subdivision to be provided to licensed home care providers. Section 6 is from House File 3575. It establishes a Human Services Department restructuring working group. And Section 7 is from House File 3543. It requires health carriers when they're setting rates for individual health plans for calendar year 29 to take into account the lowering of the premium withhold percentage from MNsure. Article 10 is the Human Services Forecast Adjustments article, and Article 11 is the Appropriations article. And Mr. Chair, would you like me to go back to Article 1 at this time?
Yes, please.
Okay. Okay, so Article 1 begins on page 1 of the amendment. The first several sections are amendments to wells and boring statutes, and they are from House File 3824 and House File 3856. Section 1 amends the definition of boring to specify that it includes a temporary boring. Section 2 amends the definition of environmental well. Section 3 defines temporary boring for this chapter, Chapter 103I. Section 4 provides that a person is not required to notify the commissioner before constructing a temporary boring. Section 5 removes language that authorized a licensed plumber who does not have a well contractor's license to repair submersible pumps or water pipes if there is no licensed well contractor within 50 miles. Section 6 modifies the deadline for submitting a report to the Commissioner of Health relating to well or boring construction or sealing to within 90 days of completing the work rather than within 30 days. Section 7 amends a section on well notification fees. Section 8 amends requirements for notice to buyers regarding temporary borings. Section 9 prohibits a person from sealing a boring until a notification is filed with the commissioner, but exempts temporary borings that are less than 25 feet in depth from that notice requirement. Section 10 establishes requirements for notification regarding exploratory borings and establishes requirements for maps of those borings. And that completes the wells and borings portion of our bill. Section 11 establishes an advisory council on rare diseases, and this is from House File 2574. Section 12 establishes requirements for the Commissioner of Health to provide information about congenital CMV. And this is from House File 2653. Sections 13 and 14 establish requirements for the regulation of security screening systems by the Department of Health. Section 15 establishes an advisory council on pandas and PANs. Sections 16, 17, and 18 add alcohol and drug counselors to the Health Professional Education Rural Loan Forgiveness Program. Section 19 modifies the primary care residency grant program. Section 20 directs the Commissioner of Health to establish statewide tobacco cessation services. Section 21 makes a technical change based on a prior change made in another section. And then the next series of sections beginning with Section 22 are from House File 3240. These make a number of changes to home care statutes. And so those are 32 through 51. And the next section, Section 52, begins on page 43 of the amendment. Sections 52 and 53 direct the EMS Regulatory Board to adopt rules related to patient-assisted medication administration and standards for communicating with patients about the patient's need for emergency services. Sections 54 and 55 amend provisions that govern prescribed pediatric extended care centers. Section 54 amends the definition of medically complex or technologically dependent child. And Section 55 modifies licensing requirements for these centers. Section 56 directs the Commissioner of Health to distribute a grant to provide crisis telephone counseling services for people in suicidal crisis or emotional distress. Sections 57 and 58 allow the Commissioner of Health to award grants through the Eliminating Health Disparities Grant Program to decrease disparities in access to and utilization of high-quality prenatal care. Section 59 updates a cross-reference. And beginning with Section 60, the next series of sections establish licensure requirements for speech-language pathology assistance. So that is Section 60 through 76. I'm sorry, it's through 77. So then with section 78, which begins on page 61 of the amendment, sections 78 and 79 establish certification requirements for unlicensed personnel who can perform cremations. Section 80 is a phase-in section for licensure of PPEC prescribed pediatric extended care centers. Section 81 establishes an older adult isolation working group. Section 82 directs the commissioner to adopt rules related to well and boring records. Section 83 directs the commissioner to adopt rules related to regulation of security screening systems. Section 84 establishes requirements for the initial appointments and first meetings of the Advisory Council on PANDAS and PANS. And sections 85 and 86 are a reviser's instruction and a repealer related to home care provider regulation. And I believe that completes the walkthrough.